Ciera and I would like to speak with you about spina bifida. Spina bifida is a complex but treatable central nervous system disorder. The diagnosis of spina bifida, the treatment of spina bifida, and the possible preventions of spina bifida will be discussed today. Spina bifida is, like I said, the most complex and treatable central nervous system disorder that comprises varying degrees of spinal cord malformation, and spina bifida is classified as a defect of the neural tube and was first recognized 4,000 years ago by according to Mark R. Foster, who wrote an article featured on Webscape. I currently work in pain management, where we treat patients who have had spina bifida, and I have also researched spina bifida in depth and have obtained a treating physician's medical opinion. Today I will discuss the 4 different types of spina bifida, the diagnosis, the treatment, and the epidemiology of the disorder. Spina bifida ranges from mild to severe cases. There is 4 different classifications of spina bifida. The most mild case of spina bifida is spina bifida occulta. This is the most mild case, and this is when the outer part of some vertebrae are not completely closed, and the sites, at the site down here, there may be like a tumor, or there may be some hair growth, or a dimple, or a birthmark. Most people don't know that they have this form of spina bifida until there's some other issue involved. This is also, like I said, the most common, with 5 to 10% of all patients having, 5% of the population having this form of spina bifida. The least common form of spina bifida is a posterior meningocele. This happens when vertebrae develop normally, but the system of membranes which envelopes the central nervous system are forced into gaps in the vertebrae. This form of spina bifida can be caused by tumors of the sacrococcyx and presacral space. A meningocele may also form desistance in the base of the skull. The form that often is the most severe complications is the myelomeningocele. Myelomeningocele. This occurs when the unfused portion of the spinal canal allows for the spinal cord to protrude through an opening of the sac that is forced here, just like you see here. This is the spinal cord that's coming through here. And about 10% of patients with spina bifida have a myelomeningocele. Children that are born with the myelomeningocele have about a 90% chance of survival. And furthermore, they have an 80% chance of normal intelligence with surgical correction. Ciera malformation is also a common form of spina bifida that occurs and is associated with myelomeningocele, with about 15 to 35% of patients needing surgical correction if they have a Ciera malformation. The most severe case of spina bifida is actually myeloschisis. It's involved whereby pretty much the child is born with an exposed spine, and they're very subject to infections such as meningitis. And this is when a plate-like mass of nerve tissues with no overlying membranes is just laying out here in the open. There are several signs and diagnoses that can explain spina bifida, but the most common physical signs are leg weakness, paralysis, bone abnormalities, bowel bladder incontinence. The patients with spina bifida, if they're children, they mostly have an allergy to latex. As much as 66% of patients with spina bifida have an allergy to latex. Dr. Jean Chitak writes at Spine Universe that spina bifida can be diagnosed prior to birth with prenatal ultrasounds or with diagnostic imaging. A pregnant woman can have blood work drawn, and we can also check the fetus with ultrasound and check for spina bifida. There may be a mass outside the body or the base of the lumbar spine at birth, and this generally contains the nerves like the myelomeningocele, or the nerves may be absent in the mass, which would just be a meningocele. There is no cure for spina bifida, only surgical correction and management of the patient's pain. Surgical correction is suggested within the first 24 hours of birth, but when you correct it right at that time, it will allow for the lowest rate of infection. Tethered cord release is performed when a tethered cord syndrome is present and requires treatment for patients with the myelium meningocele. About 33% of myelium meningocele require treatment or further prevention due to complications, and they could try to regain function of their normal life. The surgical release of the tethered cord syndrome is performed by dissection of the scarred portion of the spinal cord and the area of the myelium meningocele. Dr. Kevin Vance of Comprehensive Pain Center of Mississippi is a pain management physician who specializes in alternative treatment options for patients who have chronic pain. One complication from spina bifida is a Chiari malformation, which is a complex group of disorders characterized by herniation of the cerebellum and the large opening of the base of the skull. And I may not have a picture of that, I don't. But it's when there is an opening in the spinal canal at the base of the skull and allows for matter to leak out, and it needs to be surgically fixed. Tissue blocks the circulation of the cerebrospinal fluid in the brain and can lead to the formation of a sphinx, which is a cavity within the spinal canal. Prevention of spina bifida is on the rise due to increased availability and accuracy of prenatal diagnoses. The introduction of primary prevention of folic acid therapy prior to conception has been the most important discovery. Studies have shown that the reduction in the frequency of spina bifida are linked to an increase in folic acid prior to birth or conception. Bell and Oakley reported that currently worldwide programs with folic fortification of wheat and maize flour have prevented about 6,000 spina bifida cases since 2006 by simply adding folic acid to their flour. They note more countries can require the addition and continue to help reduce spina bifida cases. The daily average of folic acid should be which is suggested by the U.S. Attorney General to 0.4 to 0.8 milligrams of folic acid. By adding the fortification to the flour, it could be up to 400 micrograms. The epidemiology of spina bifida is estimates by the Centers of Disease Control that spina bifida is two of the most common neural defects and affects approximately 3,000 pregnancies yearly in the United States. One of the most common birth defects with an average worldwide incidence of 1 to 2 cases per 1,000 people is births are born with spina bifida. A patient that is born with spina bifida is more likely to have children that are also born with spina bifida. The most common incidents worldwide were found in Wales and Ireland, with 3 to 4 cases for every 1,000 births in 1970. The conclusion today is, first, I really appreciate y'all's time, and I have discussed the 4 classifications of spina bifida, the diagnoses of spina bifida, the prevention and treatments in each. In addition, the epidemiology associated with the disorder has been explained in depth. And I hope today I have given you a better understanding of spina bifida and the further treatment and prevention of